I am Dr. Tefe Edebi, consultant psychiatrist, and I am the medical director of Tranquil and Quest, Nigeria. Today we will be talking about anxiety disorders. Anxiety disorders is a broad term for various types of anxiety challenges. But first of all, I just want to talk about the anxiety. Anxiety is an emotional response to a distress that is considered a threat. So if one feels threatened in a situation, he is likely going to feel anxious. So anxiety is a normal response. But when we now use the word anxiety disorder, we are talking about a normal response that becomes very intense and impacts on the person's functioning. Once the symptoms become quite intense and the impact on the person's functioning and it is recurring, then it becomes a disorder. It goes beyond just saying it's a normal response. Now, when we look at anxiety, it's a quite common mental health condition. Very, very common. And many times, people who have anxiety challenges will not present in a psychiatric hospital. They are more likely to present in the general hospital. So often it is missed. It is said that in the general population, even though there are different types of anxiety, the prevalence, that means the occurrence of this illness in the society ranges between 3 to about 6% in the general population. That means 1 in every 20 person in their lifetime may have experienced some level of intensity of anxiety challenge. Now, there are different types of anxiety disorders, but I'm going to just talk about 3 broad types. First of all, we have the type that is called the generalized anxiety. This is when someone experiences some level of anxiety and there's no specific situation over different things, always feeling anxious, maybe over the car, over family, over work, but just continuously. Those kind of people, you often hear people use the word, they tend to worry about things. Then you have what is referred to as phobias. Phobias is anxiety that is directed towards a specific thing. Remember, I said that generalized anxiety, there is no specific situation. But for phobias, there is a specific situation. So you could have someone who has fear of flying, fear for snakes, fear for driving, fear of the issue of death. There's a condition called thanatophobia where some people are just focused and afraid of the concept of death. Once they hear about death, they are anxious. Then you also then have panic attacks. This is quite common. Panic attacks they are brief. So unlike generalized anxiety that is always present and not specified, for phobias, it is specific. So when the individual is in a specific situation, he experiences anxiety. But for panic attacks, it could be situational. So it could be directed in a situation, or it could just be general. But what is characteristic about it is that it happens within a specific time, but it could occur several times, even though it is short, but it could occur several times. And then it is characterized with an intense fear of death or a feeling that one is going to lose their mind. When we look at anxiety, it's beyond just saying it's an emotional response. There are actually different symptoms that classifies a situation as an anxiety disorder. I would like to look at it this way. There are GI symptoms. When I say GI symptoms, I mean gastrointestinal symptoms, meaning that symptoms that are associated with the gut. So, for example, you have someone experiencing some level of discomfort in their tummy, or you have someone stooling, or someone saying that I feel gas in my tummy. Those are some of the GI symptoms. They are broad symptoms of anxiety, a lot of symptoms. Then you also have the cardiovascular symptoms of anxiety. So you have someone that is palpitating. Palpitation just simply means that you can feel your heartbeat. All of us, as far as you are living, your heartbeat is functional, but you don't feel that your heart is beating. But the moment you feel and you are aware of your heartbeat, then that is called palpitation. You could also have raised high blood pressure. So if someone is experiencing anxiety, at that point you have blood pressure going up. You also have increased pulse rates that occurs with anxiety. So these are symptoms that could occur with anxiety. Another, then we look at the respiratory symptoms of anxiety. So you have someone that has a feeling like I'm being choked, I can't breathe, and fast breathing. Then difficulty with breathing. These are GI symptoms of anxiety. Then you have musculoskeletal symptoms of anxiety. So, for example, you may have a feeling of pain, particularly in your shoulder, pain in your calf muscles, pain in your lower back. This is really as a result of tension. Then you have symptoms that I would classify just broad. You could sometimes experience something we call depersonalization. That is called depersonalization, where you don't feel like you are real, or you don't feel like the environment, which is derealization, don't feel like the environment is real. So when you experience those kind of symptoms, they are usually very uncomfortable, but I must clearly say this, that they are not life-threatening. But anxiety is just that discomfort, that emotional discomfort or emotional response. So there is the description where someone says, I feel worried. But beyond just feeling worried, there are also physical symptoms, which I have listed out. And so that is what forms for the symptoms. So if, for example, someone constantly feels this way and there is no specific issue on ground, one will then one will begin to look at, is it that this individual has generalized anxiety? There's also the issue of sleep. With anxiety, you could have poor sleep. You could have problem initiating sleep. You could have problem sustaining sleep. Someone who's anxious, just imagine a simple scenario. I'm getting ready for an exam. I'm getting ready for something exciting. Maybe I'm expecting a good news. I'm likely going to stay up. I'm likely going to stay excited. So if you start experiencing these things and you can't literally place your hand on why you feel that way, you have difficulty sleeping, then also some of the other symptoms that likely come with anxiety could also be drug use. So sometimes people have anxiety challenges. To address their anxiety challenges, they take drugs. So you may be drinking more, you may be smoking more, you may be using all sorts of drugs to curb that feeling of discomfort that you experience. Those are all symptoms of anxiety. So when you see that happening, it should be like a red flag. So what do I do if I have all of these symptoms and it becomes distressing to the point that it begins to affect my functioning? I can't, and sometimes I have poor, if you notice that, I find it difficult to concentrate and it's beginning to affect my work. I have sometimes intrusive thoughts. I'm on my workplace, then I think about something and maybe something's mentioned and I'm worried. What do I do? Well, I would suggest this. I think you need to go see a professional. Maybe read it up first. You could Google and check out your symptoms, but go see a professional. One of the things that a professional will do is that they will run investigations. They will do tests. They will do baseline tests. But one particular test that is very important, particularly if you present with this, is something called the thyroid function test. That will definitely be done for you, because thyroid toxicosis, which is symptoms associated with your thyroid gland, can't present with things that look like this. Then they will test for your adrenal glands. Pheochromocytoma could present with symptoms that look like this. So they are going to also do a test for that. Once those two basically have been done, and of course, because sometimes anxiety disorders will present with what looks like a cardiovascular problem, they are definitely going to do ECG, check your blood pressure, just do your basic vitals. But sometimes I must say this at this point, that there have been people who present in the hospital with what seems like high blood pressure, maybe during a panic attack, or just when they come in anxious. Some people have what is called the white collar syndrome. They come into the hospital, but you need to also check that person's blood pressure outside the hospital. You need to check them when they are at a good place. So having described the symptoms, one will wonder, does everybody have anxiety? I mean, at some point, it seems like we have experienced these various symptoms. But like I said, it has to be very intense. It has to affect your functioning.